All right. Hello, everyone. Welcome to day 4 of the Neuroplasticity Alliance's Neuroplasticity Therapy Innovation Boot Camp series. It's a lunch and learn for us to talk with experts in the field of neuroplasticity and have them talk about not only their protocols and their programs, but to share at-home techniques that you on your end can use if they're a fit for your neurological challenges that you're facing. As you may know, March is Brain Awareness Week, or month, I should say, and this week is Brain Awareness Week, the 13th through the 18th. So in honor of that and to help celebrate, we are hosting our Lunch and Learn, and we hope that you find value in what we've been able to share. The recordings from each of these sessions this week will be available on our YouTube channel. That's Neuroplasticity Alliance. We do have content on there already from our summit that we held back in October. So if you're interested in learning about some of the other therapies and neuroplasticity in a little more detail, you can head over there and check that out, and hopefully you'll find something of value there as well. Let's see, I want to give it just a few more minutes before we dive in. And while I'm waiting on a few more people to join, I'll just share a little bit of background with you about the Neuroplasticity Alliance. My name is Sherry Odom, and I am the Executive Director and founder of NPA, and I'll be your host for today as well. NPA was founded to help generate awareness of neuroplasticity-based therapies and to help bring those therapies out into the public domain, and help make them not a therapy of last resort, because so many people go after these after they've tried more traditional therapies and really find benefit, which was the case for me. After years of trying to manage my mother's multiple sclerosis and my daughter's dyslexia and other individuals in our family with depression, we tried neuroplasticity-based therapies after reading Norman Doidge's book, or books, I should say, and just found miraculous benefit after those. And that really was the impetus for the foundation of NPA. And my goal is to try and help as many people as I can by inspiring hope and access and knowledge around neuroplasticity, which really gets to the root causes of the neurological challenges. And we are joined today by Ms. Rene Mills, who is a speech language pathologist. And she is one of those neuroplasticians that really has hands-on experience. She's got 30 years of working and specializing in TBI, dealing with more complex cases for traumatic brain injury. She is on the board for the Brain Injury Alliance of Colorado, and she has been recognized by the Brain Injury Alliance of Texas for her professional collaboration and the work that she's done to help bring awareness for that. In addition, Rene is also a trainer for brain injury or for speech pathologists who are dealing with brain injury on a national level. So she really knows the nitty-gritty hands-on for complex issues. She works with Collage Rehabilitation Partners, which is located in about 11 states, I think.
Yes.
And is that right, Rene?
Yes,
okay,
correct.
And you can find those on their website, and they offer both residential and at-home services, and really have a strong focus in neurological rehabilitation. So I'll let Rene give you a little more background on that. But I think we'll go ahead then and just get started. And welcome, Rene. We're glad you're here.
Thank you, Sherry. I'm happy to be here, and I was excited to learn more about Neuroplastic Allies. I think what you're doing is terrific, and I'm excited to talk with everybody today about some general principles of neuroplasticity. I have an exercise for you that is visual and language in nature, and we're going to practice that towards the end. But first, I thought I would share some information with you, and I would like to add that I would like this to be be a very dynamic presentation. So I want to be sure that you get to ask questions, and Sherry will be moderating and answering those questions. So feel free to ask away. I want this to be a give and take, and I want to be sure you're walking away with some good information that will help you if you are a survivor of TBI, or warrior, as we call that in the Seminole Spirit group that I'm a part of. So let's get started. What I'd like to start off with is a bit of information about neuroplasticity. And I'm going to give you a definition that if you go online and if you research the major databases from National Institutes of Health or PubMed, Frontiers, there are so many clearinghouses of research that that are free and that you are welcome to peruse. And I encourage you to, so that you understand neuroplasticity. However, when you're looking at all of those, the thing that you're going to find is that the definition of neuroplasticity, this definition I'm going to provide to you, is seen over and over and over again. Okay, so if we're defining neuroplasticity in terms of how the brain is able to grow and continue past that normal developmental period, the definition is it's the ability of our nervous system to change its activity in response to intrinsic, meaning internal, or extrinsic, meaning external stimuli by reorganizing the structure, the function, or the many connections through the brain. So that's our working definition for today of neuroplasticity. I would like to mention that developmentally, when we are developing, if we're a normally developing child from birth to age 5 will have its greatest period of brain maturation. So that's when the white matter is coating the axons. That's when we have a lot of growth, a lot of change. I will also tell you, ironically, that's the best time for folks to learn a new language. And this is just a side note from a neuroplastic standpoint. But I think in the US, we wait far too late to teach additional languages. We go way past that 5-year age. We tend to begin them at the junior level, or the junior high school level. So you're working with someone who is 14 or older. And I think as a whole in the US, our educational system should be teaching languages much earlier, even age 4 or 5. So if you are a bilingual household, or you know someone who is, they need to be working with their child on the second language early on, and it will help them learn quicker and have a better establishment of that second language. So that's just a little plug, something that I feel very strongly about. We also know, as we're talking about neuroplasticity, that most development, the major development, particularly the frontal lobes here, ends around age 25 or 26. So that's when we consider the brain to be fully mature. Not at 18, not at 17. The frontal lobes still are not fully developed at that time. So I just wanted to point those two timelines out, Sherry, the age 5 and then the age 24 to 25. However, that does not mean, and we now know this, and certainly you've had wonderful speakers this week to reinforce that idea, that neuroplasticity can occur throughout the lifetime. And I will share with you, I have been a therapist for 30 plus years. And when I started out in grad school, I would say, I guess that was, I hate to say it, 34 years ago or so, we were taught that we had 1 billion neurons in the brain. And from the day we were born, we began to lose those neurons and we don't regain them. And that was a disturbing thing to learn. However, what we do know now is that because of advanced imaging, neuroimaging that we have, we do know that our axons can sprout new growth, our dendrites can sprout new spines, and that we can form new connections, much like when we're building highways in the US. And if you all have been following what's going on in California and the horrible floods that have cut off roads or wiped away roads, well, that's much like our brain. When a road gets swept away by water, we've got to rebuild that road, right? We've got to maybe route around it or even pave over it. I think that's very analogous to what's happening in our brains as we're working to rewire them. I will say that as we age, the process is not as robust. It is a bit slower. It does require more practice. Our neuromodulation ability isn't quite as strong as when we're younger, but that doesn't mean that we can't do it. So that's my main message today, and a message I'm happy to share with people as a therapist that's been practicing for so long. So I thought, Sherry, we might start out with some general guidelines of practice for neuroplasticity, because I get this a lot as a therapist when people are ready to go home. They've completed our portion of the rehab program, and what I like to tell our TBI warriors is that you're not finished. You know, this is one step in your rehab, but it doesn't mean you can go home and you're done and you don't have to do any more practice or any more work. You need to continue. So what should that practice look like? You know, I have folks who tend to go on the one end where they think I need to spend 3 hours a day on this, just like college. And then others who think, oh, if I do it 10 minutes here or there, I'm going to be fine. What I tell them are these following things that I'm going to share with you right now. It's very important when you're practicing that you don't do it when you're mentally fatigued. And that goes for us individuals that haven't had a brain injury. If we wait till the end of the evening, when we get home, we've cooked dinner, we've got the kids situated and settled with their homework, getting them ready for bed, and we think, okay, I've got some me time now. It's time for me to practice on my neuroplasticity. For some of you, that may work fine. For me, I know it won't work well because my brain is tired. For individuals who have had a brain injury, it probably won't work for them as well. I'm not saying you can't do it, but I'm saying your optimal time is when your brain is fresh and when you are not fatigued. For many people, that's in the morning or that's after they wake up from a nap and they've given themselves a chance to wake up and be alert. Another question I frequently get is, how long really should the practice be? It should be 20 to 30 minutes. It does not need to be a full hour, but it does need to be more than that 10-15 minute mark. I would suggest that you aim for 20 to 30 minutes of practice a day. And when I say practice a day, if you miss here or there, that's not so bad. But one of the hallmarks of neuroplasticity is consistent repetition. And indeed, if you go online, there's some wonderful top 10 facts about neuroplasticity. I didn't print one for us here today, but if you Google neuroplasticity principles, you're going to find, and go to images, you're going to find some wonderful little cheat sheets and little posters and little lists or schematics of what are the top 10 principles, basic principles of neuroplasticity. One of those is consistent repetition, or what we call experience. You need to have consistent routine practice, and it needs to be, you know, for our program, we say in order to master a task, someone needs to do it 300 to 500 times. You know, if we're practicing even PT, physical therapy, is practicing transfers. They're trying to get someone's legs stronger so they can stand up in the wheelchair and be able to participate. We don't need to do it just 3 times a day. We need to do it 50 times. We need to do it 100 times. If we're working on word finding, we don't need to just do it 30 minutes in the speech therapy session or an hour in the speech therapy session. It needs to be all day long. And indeed, in our program, the physical therapist, the occupational therapist, the behavioral technicians also practice those same things, working on word finding or going from sit to stand. So if you're feeling like, as a TBI warrior, whether you're in a program or you've just left one, or perhaps you're a few years out, if you're feeling like you're not getting the results you need, I suggest you look at your repetition levels, and they might not be consistent enough for you to achieve the level that you want. Another principle is that you need to set a task, a novel task that is of interest to you. And we joke around in the Seminole Spirit Support Group that I'm lucky to be a part of. I'm the speech therapy consultant. Novel task means new, not novel as in reading a book. And this is the critical piece here. This is hugely important. If you don't take away anything else today from the information I'm sharing, I hope you take this piece away. It has to be a new task that you are totally unfamiliar with. I'm going to give you some suggestions here in a minute of what that might look like, and based on your particular problems, what you might select. But you don't need to pick a task that you're familiar with or that's comfortable to you, because it will not be neuroplastic in nature. A final principle, and this is critical too, is the practice you're doing should feel challenging. You should feel like it's difficult and that it does indeed require focus, and it's taking more of your cognitive reserve than it usually does. You should feel like, wow, I'm really having to focus here. I've got to turn off the music. I've got to turn off TV. I don't need anybody talking to me. And it's important that you become familiar with this feeling, that level of feeling that, oh, wow, I've really got to focus. Because if you're not feeling that, you're not working at an effective level. So these are all important principles as you're engaging in neuroplasticity. Make sure your brain is fresh. Aim for 20 to 30 minutes a day. Be sure it's a task you're not familiar with, and tune in to how you're feeling as you're engaging in that task. Make sure that you feel like, hey, it's a little bit above my level. I'm having to really focus. Conversely, I want to say it shouldn't be so difficult that you're frustrated, you get angry, and you feel like you can't do it. Then you're trying too hard. You might want to find a task that's a little bit easier. What are some practice suggestions? Well, I have got some good news for you. When I'm providing information to families as they're getting ready to leave our program, or to patients, or I'm talking to the Seminole Spirit Support Group, and their fearless leader, Mark Halverson, is on today. I saw that he was on. When you are looking for something to do, the world is open to you, thankfully, due to the internet. One of the things I love to suggest is learning a new language. And there are many, many tutorials on YouTube that are introductory. So I'm working on Italian right now, and I was working on Turkish the other day. And if you want a mind blow, just go try to learn Turkish. Let me tell you, because it is totally different. It's not like Spanish or French is to our language. It's very, very different. But it's great because you're really having to focus and you're really having to think. I'm not advocating any one particular language. Choose one that you're interested in. This should be fun. It should be interesting to you. You only need to spend that 20 to 30 minutes. If you want to spend more, that's fine, but at least get 20 to 30 minutes in. For those of you that aren't interested in a language, go onto YouTube and learn a line dance. If you're more physically motivated, learning a line dance is terrific, and I'll tell you why. You're having to focus on auditory information and visual at the same time, because the instructor is giving you instructions and you're also watching them. And you have to learn a sequence of steps and then put it together. I think that's a fun way, and we do this at times in our programs. It's a fun way to work on movement, on balance, and get yourself up and moving, but also work on neuroplasticity. For those folks that might want some practice, fine motor practice and hand-eye coordination practice, learning to knit or crochet tutorials are terrific. I had a patient, I was lucky enough to have one of my patients about 20 years ago teach me to crochet. And I haven't done it in about 6 years, and I picked it back up to make a baby Afghan. And I found myself really having to focus on this pattern. I'm almost finished, but it was a nice thing to do, because I had to read a brand new pattern, and it was a new activity for me, even though I knew the basic stitches. So I would encourage you, you probably see a theme here. You can do anything you want. There's so many YouTube tutorials. Pick what you want. I would also say, select a teacher. You may have to go through a few videos, and that's not a bad thing. Select a teacher that you follow well. Some teachers may speak more frequently. They may be too talkative for you. They may be too distracting. I find that I might go through 2 or 3 when I find someone I really click with, and that's okay. Find who you click with. I'm currently working on handstands, so I'm trying to learn how to do handstands, which is really good upper body practice, especially for an older female. And I went through several folks before I found someone who is a YouTuber that spoke nice and slowly, was very encouraging and positive, and I did so much better with his lessons than others. So it's okay to shop around. Another suggestion I had is for men, because I realize some men may not want to line dance or do knitting. Look online on how to do simple repairs or how to make things. There are so many how to do it videos now. I learned how to take an earring out of a P-trap drain. Never had done it before. And you want to talk about neuroplasticity? A woman who's never made a repair and has always had some male fix it for her. I actually learned how to take the P-trap apart and get a little earring out that got stuck in there. So that was a point of growth for me. So I want to invite you to check these YouTube channels out. And I would like to make a mention about Coursera courses. If you have not heard of these, they are fabulous. Coursera is free. Just log on to Coursera, and they're free courses you can audit. They're university courses from all over the world, and you can audit them. Some are language, some are more complex, like math or real estate. You can go to whatever level you want, but the idea is they're free. And we actually use Coursera in our programs if it's related to someone's field, if that they're studying, if they're a college student, or if they've returned to school. We use Coursera a lot, so it is free. So there are so many things open to you. These are just a few suggestions. This list is not exhaustive, and there's no way it could be. So I just wanted to share with you that if you have internet access, you can go online. The world is your oyster, and there are plenty of things to follow.
Renee,
Okay.
yeah,
Yes.
I would like to jump in there too, just for a second, because and I'm loving your very practical guidelines and comments. This is so helpful for so many people who are out there and can't really, some of these therapies are super expensive. And so I love how you're just bringing it down to access those things that are free. But a couple of other things I've been working on, I thought that I would share and maybe reiterate your principles is I've been trying to learn to do Tai Chi and doing it online, free courses. But like you said, I had to go through several different instructors to find somebody that I could follow, because it was very, very challenging for me. I guess you could put it on the similar level of line dancing, right? Trying to follow those movements, and then the breath work that goes with it, and then the thought process that also goes with it. And then the other thing I've been trying to do to kind of spruce up my brain and my synapse is learning an instrument, trying to learn the ukulele, which is
Oh, wow.
yeah, super hard for me, who's not a musical person and never played an instrument. So trying to learn that my daughter and I were learning it together, and she's left me in the dust. I mean, she's got like 6 songs and I'm still working on one. But I do I mean, after I do those, and it is about 20 minutes, it's about all I can manage before I get fatigued mentally on that. But those exercises, after you do them, I've noticed that even after like 2 or 3 sessions, if I'll do them consistently, each day, the next time I sit down, it's so much easier. That which just shows how quickly those changes can occur.
Thank you for sharing that, Sherry. That's a beautiful illustration. And think about, I love that you're learning the ukulele, because that's kind of out there, right? It's not like, oh, I'm just playing the drum or the guitar. This is cool. And I hope you play Tiny Bubbles for us sometime. That would be great. Or what is the other one? The guy from Hawaii. It's a Wonderful World and Over the Rainbow. I will not try to pronounce that gentleman's name.
Yeah, Smoke on the River. That's what
Oh,
I'm
wow. Wow, I love it.
basically.
So what Sherry is sharing with us is exactly what we're talking about. And the next time that you go into that next session, you're building on what you've already done prior. And before we go into some general guidelines for brain health, I'd like to share with you, and you're welcome to look this up if you want, but in researching a bit about neuroplasticity, preparing to talk with you all today, I just wanted to share with you a study that was done in London, and they were looking at London cab drivers versus London bus drivers, and they were trying to look at an area of the brain called the hippocampus, which is heavily tied into short-term memory, converting short-term memory into long-term memory, and it's also factored into a bit of visual spatial location, our ability to have some spatial orientation. So in this study, they did visual imaging, they did CT scans and MRI scans, and looked at the London cab drivers compared to bus drivers. And the reason why they looked at the cab drivers versus the bus drivers is the bus drivers drove a regular route. It was very predictable. It was very rigid. It was the same thing every day. However, if you think about the London cab drivers, they don't know where they're going when someone gets in the car. And it's up to them to find shortcuts, to think, oh, we've got an accident over here. We're going to have to go this way. Or traffic's really bad on this bridge, so we're going to have to find a workaround. So what that equals is a very much a fluid intelligence, a working intelligence in their mind, a spatial representation of the area, and they're having to constantly amend it and change it. And what they found when they did the imaging between the cab drivers and between the bus drivers is there was a substantial enlargement in the size of the hippocampus of the cab drivers over the bus drivers. Isn't that fascinating?
It's
So that's one
fascinating.
example. If we image musicians, that they have done functional MRIs, that, PET scans, particularly functional MRIs, and some diffusion tensor imaging, we'll talk about that in a minute, of musicians, and those who play the violin, their left hand, which does the much of the more fine motor movement as compared to the right hand that draws the bow. The left hand, in the somatosensory cortex, it's much bigger. So it's fascinating to me to be able to look at these studies and see where individuals who are repetitively engaged in a motion or an activity, to see that area of the brain is much larger than control subjects who do not engage in that activity. Same thing with people who play tennis, any kind of domain specific activity where there's a highly repetitive movement. So I think that's important to share, and I just wanted to let you all know about that. If you Google it, I didn't write down the name of the study, the gentleman who completed it, but you can Google it and find it. And I just wanted to share that with you because to me, that is a very great way to illustrate when you're having to have open-ended exercise and thinking versus a very regular, same type of activity. That demonstrates what the principle of neuroplasticity to me very well, because if we do the same thing every day and don't vary and keep it very regular, we're not going to grow. In the early stages of brain injury, we tell people you need to keep a consistent schedule. You need to do the same thing every day because your brain is trying to heal. But when you get out of that period, usually it's thought of most spontaneous recovery occurs within the first 6 months and possibly up to a year. But when you get beyond that first 6 month period, then it's a good idea to work on more difficult neuroplastic types of things and not do the same thing. So I just wanted to throw that out there and share that with you. Now, how can we maintain our brain health? So
Renee,
these
I'm
got,
sorry.
yes, go ahead.
Yeah, I'm sorry. We had a question I thought was good just for this discussion.
Okay.
It was about American Sign Language and whether that really was a neuroplastic event. I'll let you take it.
Oh, I love that question. And to whoever asked that, absolutely. It is, it is a neuroplastic event if it's new to you and you've not done it. And the beauty of that is you're involving fine motor control, right? And you're involving integration of both. We call it bilateral hand integration. You're involving that with the language centers of your brain and trying to connect it, right? So I think that's it's another language. It's another language, but you add in another factor that it is physical in nature and that it is dealing with the hands. So absolutely. Great question. I don't think I've had that question before. So wonderful.
Renee, kind of along that around your principles, and you mentioned the fine motor skills and movement. One of the, I guess, definitions around neuroplasticity or a way to identify whether an activity is neuroplastic is you're using action, thought, and emotion, one of or some combination of those three things. If you're engaging one of those three things in a new activity that, as you said, sort of is unfamiliar and that challenges you a little bit, but it either so action, thought, or emotion. Do you have some thought around that?
Well, I agree with that. And here's what I would add to that. Depending on the areas you're trying to work on, for some people, they're trying to work on attentional skills, or they may be working on word finding. So that is more idea-based or thought-based, right? Then there are others who are frustrated because I've got a gentleman in our program right now whose right hand is not quite working like he needs, right? It's just not working as well as he needs, and it's his dominant hand. So of course, there are times where we'll have him put his left hand. We don't do constraint-induced therapy all the time. It's not been shown to be as helpful with traumatic brain injuries as stroke, and I won't get into the weeds too much about that, but it is helpful to engage in tasks where he's having to move that hand and work on the fine motor. So that would be an example of a more motoric based. I think when you add in the component of emotion or feeling, that it even adds another layer and another level of connectivity, and it can tie meaning, whether it's physical based or more idea based. And an example would be a song that is very meaningful to you. It could be an activity. If you have young children, maybe it's an activity that'll help you as you're engaging in play with your young children. So I think there's opportunity to tie those things in together so that they have meaning, whether it's more of a motoric based activity or where it's more of a thought based or sensory activity. So there is potential, and there's certainly activities that hit all three.
Yeah.
Definitely.
Yeah, smells is another one of those sensory inputs, right? That can have a lot of emotion associated with that. And I see on the slide here, you've got mindfulness, which is, that emotional regulation, and those thoughts and emotions, doing activities that help bring that emotion into an area of preference is that emotional component is a big factor in that practice, I believe.
Absolutely. And I'll add to what you just said about smells. So our sense of smell, our olfactory memory, as we call it, is so strong because it is the only sense that does not route up through the cerebral cortex, that's not routed from the thalamus to the cerebral cortex. And our thalamus is our ingoing and outgoing sensory relay station. The sense of smell is the only sense that doesn't get routed up through the thalamus. It goes from the olfactory bulbs to the center in the brain, sensory center in the brain. That's why if you suddenly smell a yard, the smell of cut grass or cotton candy, or maybe popcorn at the movie theater, you're instantly taken back to that time and place where you first smelled it or where it had a lot of meaning for you. So olfactory memory can be tied into emotions quite strongly simply because it doesn't get routed through the thalamus. And I do want to go ahead and talk about, I think that's a good segue, Sherry, into the general guidelines for brain health. So this applies to all of us, not only brain injury warriors, but it's even more important for those survivors and warriors of brain injury because it will help keep your brain as sharp as it can. And help you function at an optimal level, especially as you're engaging in these neuroplastic tasks. So none of these are rocket science, and none of these should come to you as a surprise. They seem quite basic and um, what's the word I'm looking for? They just seem kind of intuitive, really, but they're critical. If one of these is not occurring, you're not going to be performing at your optimal level. So the first thing I love to talk to people about is eating a more healthy diet. And quite a few of our survivors have maybe been fast food junkies. They're in a hurry and they tend to eat burgers and fries and chicken and anything through a box that's given through them through a box in the window. We know, and quite a bit of research has been done at the molecular level, thankfully, that we know that blueberries, walnuts, omega-3s, all of these fresher type foods that have less sodium, less, fewer nitrites, that foods that are fresher and less processed, leafy green vegetables, those can help your brain. They feed your brain. Uh, so healthy diet is very important. And it was once said, you are what you eat, right? So after brain injury, it's even more important that you're eating fresher, healthier food. It's also important that you get regular restful sleep. And I put restful in there for a reason. Sleep that is interrupted frequently, maybe because of the brain injury, you have to get up during the night to urinate. Maybe you're having pain that hasn't resolved from headaches or orthopedic injuries. If you're not getting restful sleep, it's important that you ask your physician for a sleep study so they can find out what the nature is. Quite a high percentage of traumatic brain injuries have what's called a central sleep apnea after their brain injury, and a sleep study can reveal that. So regular restful sleep is restorative sleep is what helps prepare your brain for the next day and helps you perform at your best. This third one is critical, and some people are in denial about it. Avoid alcohol and illicit drugs. Alcohol can make the blood vessels more brittle over time, over years, and more prone to breakage and bleeding. So it can cause more bleeds in your brain. Alcohol can also lower the seizure threshold in individuals with brain injury and make them more susceptible to having seizures if they haven't before. When I put illicit drugs in there, there's an elephant in the room. I live in Colorado, and it is one of the states that where marijuana is legal. And I have quite a few young men that will come in and say to me, Rene, I'm not giving up my marijuana. It's organic. It's not like these other drugs like cocaine and meth and all those other drugs. It's organic. It's natural. Well, I've got news for you. While it's natural, chronic repeated use of marijuana has been found to not be good for the brain. There are some medical conditions where it is used, like cancers and other medical conditions, to stimulate appetite, to encourage relaxation, but it is not good in the case of brain injury. And I get to work with Craig Hospital, a center of excellence, regularly. They're not far from our program here in Colorado. And they've shared with me one of their articles about marijuana use, and I make sure I pass that out to some of our younger folks that are insistent that marijuana is okay. It's not good for your brain. Another principle or general guideline is get regular cardio exercise daily. Not only does regular cardio help in relieving anxiety and keeping your heart healthy, it helps to make sure you're getting good oxygenated blood to the brain. And what are the two things our brain needs? Glucose and oxygen. Those are the two main substances that our brain needs to function at an optimal level. Cardio does not have to mean that you're kickboxing or you're running. A good walking pace where you're getting your heart rate up is fine. It's free. It's healthy, and you get an added benefit. If you're outside in the sunshine walking, it helps you create vitamin D. It takes about a good 15 minutes for sun exposure to help you create vitamin D, which many brain injury survivors have been found to be very low in, and that can affect your sleep. So there's a double benefit there to walking outdoors. And then finally, mindfulness practice. We incorporate this really heavily in our Colorado program. We actually have a daily session of it. Mindfulness practice doesn't have to be long. And once you learn how to do it quiet in your mind, close your eyes, you can have them semi-open. Once you learn how to focus on one thing and not be multiply distracted, it's something that can center your day as a brain injury warrior When you find you're getting more tired in the day or before a tough task that you have to do, it can be helpful to just even do 5 to 10 minutes to refresh yourself and get ready for something that you think might be difficult. So those are the general guidelines for brain health. And again, they're nothing new that you haven't heard before, but they're all very critical building blocks for a healthy brain.
Renee, you mentioned, I guess diet and nutrition. And do you have any thoughts on nitric oxide? It's something sort of Andrew Huberman recommends or has talked about as helping boost your brain activity. And you mentioned, vitamin D, so taking vitamin D supplements. Are there any supplements on a generalization that you recommend?
I like that question. I will tell you, it's difficult to recommend general supplements across the board because a physician needs to look at those because they can interact with medications that you're taking currently. And
Mhm.
there are some supplements that'll interact with anti-seizure medications and some pain medications. So what I would say, there are some supplements out there that have been found to be very good. If you have a well-balanced diet and you're getting good rest, I think it's important to check with your doctor. A lot of people do take a multivitamin and they will take vitamin D, particularly patients that we have from CRAG. Those are two things that generally they do have. Uh, I will say this, I haven't researched that enough, Sherry, and I would be happy to look into that because I'm always interested in evidence-based practice, and if there is research to support that, and if it's shown to be helpful, I'm happy to look at that because I think there are some supplements that can help. I will also say I think there's some on the market that get a lot of hype. Not saying this one in particular, I simply don't know enough about it, but there's some that get a lot of hype and you're wasting some dollars. So right now at this time, until I've done a little research into it's nitric acid, you said, I believe.
Nitric
Oxide. Okay.
oxide. Yeah,
Well, I'm going to look into that, but at this point, I just don't know enough about it to give you an educated opinion.
okay, yeah, thank you. And
Sure.
I see you have your exercise brought up there. And before we go to that, there's a couple of questions here I think that make sense, if you don't mind.
Sure.
I said, does it matter if quiet meditation or guided mindfulness session? So, and the question here is, or body scan, poem, then silent. Charlene, if you want to clarify that last piece, I'm not sure I quite understand it, but I think the question is around meditation. Does it need to be guided meditation or just silent mindfulness?
Whatever meditation works best for you. Some people need that guided because they find that they don't have enough focus and structure. Other people don't like to hear someone talking and telling them what to do. So you've got to find what works for you. One over the other is not important. I'm wondering if by body scan she might mean the one where you start from your head and go down to your toes and you're feeling for stress, tension, tightness of the muscles, and you consciously focus on letting it go, and you do muscle group by muscle group throughout the body. That's an excellent one too.
Yeah, I do think that is what she was referring to. It just didn't come to me at the moment. So thanks for pulling that out.
Well, and that one has benefits. So I'm glad, if it was Sherilyn who said that, I'm glad she mentioned that because that has value when you're out and about doing activities, or maybe you're at work, or maybe you're at school after a brain injury. Maybe you're engaged in something that might be kind of tough for you. It's always good to do that body scan, and that body scanning helps you become familiar with, well, what's going on right now? Am I clenching my jaw because this is tough? That can result in headaches later on. Am I sitting down in my desk or over my desk at work because I'm so stressed about doing a good job and I'm trying to focus that my shoulders are humped, and I go home every day with aches that I didn't have before? That body scanning can be helpful. And again, for those of you that aren't familiar with it, it's you primarily do it in a lying down position, but you can do it in any position. You just start at your head and you focus on how you feel. And if you consciously breathe in and breathe out and relax that muscle group, and it helps you get really in tune with your body and notice when problems are starting to crop up. So I think it has immense benefit.
Yeah, I agree with that too. It's something I do actually sitting at my desk because just like you said, I'm constantly like that over my computer and I have to consciously force myself to sit back, which automatically just relaxes myself. And then a body scan helps me understand, like, what is it? Am I sitting wrong? What's causing the tension there?
What am I doing? And when you
Yeah.
sit up, you're also getting better oxygen into your lungs, which is important. You know, if we're hunched over, and a lot of us these days, since we're on computers so much more, we're sitting in a chair that may not be proper for us. We're not in a good position to fully expand our lungs, and we may be causing some orthopedic strain on our body.
Yeah, agreed. Okay, there's a question here. It says, what about prescription drugs such as stimulants or antidepressants? I think maybe the effect or impact of that with neuroplasticity.
Well, that's a very good question, and I didn't cover pharmacology. I do have some comments on that. So research is still ongoing right now about how pharmacology can assist neuroplasticity. And there's some drugs and then some amino acids and other substances that are being researched currently to see what facilitates neuroplasticity. And what I will say is there are many neurostimulants, Adderall, Provigil, Nuvigil, amantadine. There's so many. And I work in a neurobehavioral program, so we do utilize those kinds of medications quite a bit when someone is having difficulty focusing. Some of the neurostimulants have found to have benefits in helping neuroplasticity. You need to take them as directed by your physician because they can be problematic if you don't. Antidepressants can help, and there's some like a fluoxetine that has been shown to help with neuroplasticity. So I would say you need to work with your doctor very closely. If you're working with a counselor or neuropsychologist in your recovery journey, be sure you're letting them know how things are going and that you're journaling how you feel before you start the drug, when you start it, and any symptoms that you're having, and how you feel you're functioning. You need to be doing that scan yourself to say, wow, I really feel like I'm focusing better, or I'm too worked up. It's increasing my anxiety, or it's making me too sedated. It's not working in the case of some antidepressants. Some people will feel like they have a fog when some antidepressant levels are too high, or if they're not on the right antidepressant. And I will add this in relation to antidepressants and brain injury. Sometimes many different antidepressants have to be tried before the right one is found. So if you're in that category and you haven't gotten relief yet, continue to work with your physician, because I've seen people have to go through 4 or 5 or 6 antidepressants before they find the right one. Okay.
Renee, what are your thoughts around plant medicine? There's a lot of research with plant medicine and neuroplasticity now. John Hopkins Research Center for, I guess I was just looking up to make sure I understood, it's for psychedelics and consciousness research. There's a lot out there. We interviewed a gentleman a couple of weeks back about that, and it shows that it it really expands the neuroplasticity of your brain for a long period of time. So, we're looking at months from some sort of psychedelic, and they've been testing multiple different types. And so there's a lot of research on that. Have you been following that? Do you have any opinions or thoughts on it?
I haven't been following it as much as I would like, Sherry. That's something I'm very interested in. And even in Colorado, I had some folks reach out to me from the University of Boulder who wanted to look at the use of psychedelics. And they were looking at it to relieve depression. Some psychedelics have been found to help tremendously with intractable depression. I will tell you, I'd like to see a little more research as it relates to an impaired brain, a brain injured brain versus the depression and mood disorders. So I'd like to see a little more research in that area. I think it's promising. I think we don't know that the piece that I think we need to get a better hold on is, what does the dosing look like? How does the dosing work with medications the individual might already be taking? And then what do we do if because the brain injured brain, here's an important point I'd like to share with everyone. A brain injured brain metabolizes substances differently than a non-brain injured brain. We know that for a fact, and it's highly more sensitive to substances. So I'd love to see more research so we could get more of a proper dosing amount. And then there are a wide variety of substances too. Some have found to be more helpful than others, and they're all natural, right? But I just think we need some more work on proper dosing, and then how does that interact with some other common medications that individuals are taking. But I do agree it has a lot of promise. I just think we need a little bit more research, but I'm supportive of that. We just need a little bit more information, and that's great. It's always good to be able to look at something new and say, look, let's look at this and this variable, and let's add to our knowledge base about it so we know that it truly works. So I'm in favor of it. Just we need some more work.
Yeah, I think there's a lot of research ongoing now with
Yeah.
that. And some of the most relevant research that they've done is with veterans from PTSD that have shown a lot of promise with depression and some of it even with some concussions. But I do agree there's a lot more research that needs to be done before it can be used in a methodical and safe way. But it's interesting to where
We'll
it's
get there.
going.
We'll get there,
Yeah.
but it is exciting. It's an exciting area for sure.
Yeah, it is. It's very exciting. I think the promise of it is huge. Okay, I see you have an exercise. I'm excited about this one because it looks like it's a little bit of a challenge. So do you want to go ahead and dive in?
Sure, happy to do this. So for everybody that's on right now, grab a sheet of paper. This is old school, so we're going to do pen and paper or pencil and paper. And I'm going to tell you all, I found this online. I did not create this. I'm not smart enough to create this, but I'm always on the lookout for things that we can use. So this is no neuropsychological test. This is nothing fancy. This is simply a fun task that is going to be challenging because for most of us, it's something we've not done before, but it's taking the idea of symbols and coding and applying them to something we know, which is the alphabet, and trying to create messages. And this can be used in two ways. You can take a sentence, a regular English sentence, and transfer it into the code, or take a code and decode it into the alphabet, into a regular English sentence. So this is something I'm happy to share with you. If you look online, you'll see it too. I just thought it was a fun activity, and I particularly liked it because we're working both sides of the brain. Our left side of the brain, I'm sure many of you know, is considered linear, logical, language-based, and our right side of the brain, on the whole, is more considered holistic and spatial. On the whole, there are some people who are left-handed who are primarily functioning in the right side of their brain, but this activity really brings both sides together. So as you're looking at this, you can see that there are 4 sections of symbols, and underneath each is a grouping of the alphabet. So A through I in that top square is represented by basically a tic-tac-toe board. And the next part, J through R, is symbolized by the tic-tac-toe board with dots in it. The STUV is symbolized by an X, and the WXYZ is an X with dots in it. So I want to challenge you. Your task, and I'm going to give you a few minutes, is to write, my name is whatever your name is. Okay, you've got to figure out your name. And if you look, for an example, let's look below the word my. See where the M is? The M is in the middle. The J is above it. The P is below it. So each letter is going to correspond with one block of that tic-tac-toe board. The J is represented by just a line, vertical, horizontal, and a dot. The M below it is represented by a line that looks like this and a dot. So if you look at the M below, it looks like a three-sided box with a dot in it. The Y, these are a little trickier for some people when we get to the X's. The Y is represented by a little backward V shape or side-lying V shape with a dot in it. So what I want you to do, I'm going to give you about a minute, and you don't have to write my name is, it's already there. We'll make it a little easy. Just write your name, find your name, write it out. And then what I'd like you to do is in the chat box, tell me how you did and how easy or hard you think it was. So I'm going to set my timer and I'll give you right at 60 seconds. Okay, go ahead and go. And if you have a question, Sherry and I'll be here to look if you're running into any trouble with it. Oh, John says, I'm done. Christy already did it, not hard. Beautiful, beautiful. And I'm looking back through the comments while you all are working. I do appreciate someone mentioning Senior Planet from AARP, their morning online stretch. I think that was Christy. Thanks for mentioning that. I always love to share new things, and I certainly appreciate folks who've tried platforms out or websites out to let me know. So thank you for sharing that. I think George said he taught himself some Spanish and French. This is great for eye scanning and working through, timer's done. Yes, Chelsea, I agree. It's great for scanning. This is great for people who struggle with some visual perceptual or visual spatial skills. And again, those are primarily found in the right parietal and then the right occipital area. Okay, let's see. Anybody else? Anybody else want to give us a thought before we move on?
I did it. I wrote Neuroplasticity Alliance besides that.
Oh, look at that. That's great. That's great.
Yeah, that was a good challenge.
This is a fun activity, but again, it's novel, right? For most of us, we've never seen it before. And you want whatever you're doing to be novel, to be different, so that you're really working on neuroplasticity. So that's key. I picked this because it was a visual exercise and not an auditory, but you can also, James says it was easy. Great, great, James. So I picked this on purpose because I really wanted to work on the visual and visual spatial modalities today. There are other things like learning a language can be more auditory based. It can be more visual if you're working on reading and writing the words versus listening and speaking. So this was just one example, certainly today. And I have one more slide I want to share. If you would like to get a hold of me and you have questions, I'll do my best to answer them. If I don't have an answer, I will try to find an answer for you. I don't know everything, I'll freely admit it, but I sure love sharing expertise and experiences among all of us. I think we can help each other learn. So you can email me at rmills@learningservices.com. My N didn't get all the way up there on the screen. I'd like to say it's a pleasure talking with you all today. And Sherry, thanks for having me on today. I think your foundation is a very important one in the work that it does.
Thank you, Renee. I do have one quick question for you. You've sort of given a range and overview of neuroplasticity, and you've talked about some of the activities that you can do to stimulate neuroplasticity. Are there certain types of activities that would be better suited for certain types of neurological challenges that a person with a TBI might experience? Do you understand about that question?
I do. And there are some really good programs. There are many programs out there. I'll say that. I know yesterday, Dr. Hartman was talking about the BEARS platform, which is a very robust platform. There are some programs that will work solely on attention concentration. So if your issue is that, and I would like to sidebar for a minute and say attention is not one skill. Attention, there's a hierarchy. There's an attentional hierarchy, and we need to make sure we're taking patients all the way through the hierarchy. And the foundation of attention is focused attention first. Can I main focus on one thing and filter out distracting stimuli all the way up to I'm working on divided attention. I'm doing 2 or 3 things at once and shifting my mindset between 2 or 3 things, and I'm not losing where I was. That gets a lot of people. That's really tough for folks who are recovering from brain injuries. So there are some programs that online that really look at attention and information processing, speed of processing. And then there are other ones that do look on that fine motor skill part. Uh, if someone's curious, because there's so many, it's hard to go through and list them all. It's easier for me to say, yes, they exist. They're domain specific and experience dependent, and that's critical. That's very important if you're looking at improving one area. And if any of your listeners today have a question, please reach out to me by email and I can give you some suggestions. Some are free, some are not, and some are things you can find on YouTube. Everything doesn't have to be a prepackaged program, but there's certainly benefit to some of those as well.
Okay, great. Couple of questions about your client, the program that you offer through Collage and the cost for that. Do you want to just kind of answer that in a general sense?
Sure, happy to do that. So Collage serves individuals who've had a brain injury or stroke and they need neurorehabilitation. So physical therapy, occupational therapy, speech therapy, counseling, neuropsychology. In our Colorado program, Louisiana and North Carolina, we serve individuals who have neurobehavioral issues. So those are folks who can't go home because they wander and get lost. They may be physically aggressive and try to hit or hurt others. They may be verbally aggressive and they're argumentative. They may try to injure themselves or injure property, or they may just have high levels of frustration that keep them from being safe in other programs or in a home setting. We also have day treatment services where individuals come from a period of 5 to 6 hours a day and then return home and stay at home, but they come through our program like they're taking classes at school in a way. And then we have home and community in several states and we're expanding. We do take workers' comp and we take some private insurances, but you'd have to check state by state. The commercial insurances vary state by state. And then if you're curious about prices, it really depends on whether you're looking neuro rehab, neurobehavioral, and you can contact our admissions director. It's on our website and they can give you an idea of what we might be looking at if it's private pay. So we have a range of programs and love what we do because we really enjoy working with patients and their families to individualize programs. We don't like to use cookie cutter programs. We want to individualize what we're doing to that person, their work history, their home life, and their experiences. And it's a pleasure to work for this company and be able to be as creative as we want to be to help people get their lives back.
Rene, you are outstanding. It's amazing. I'm so thankful to have you on today to be able to share some very specific hands-on advice and knowledge in general about neuroplasticity, about brain injury, about how people can work on their own to improve their skills at their own, well, I was going to say at your own pace, but we know that's not what you're supposed to do, right? It's got to be, repetitive in that 20 or plus minutes every day. But those are very helpful skills. I'm going to encourage everybody to jot down her email here if you're interested. I will have both her email and the website link in the recording for this. I'll include that at the end of the recording. And so you can access that. And if you've got specific questions about Collage's payment schedule or what kind of insurance they take or anything like that, then encourage you to reach out to them directly or Rene, if that's your preference. But I think Rene is man, you're a one in a million, Rene, and we're very thankful to have you with us today. Is there, I guess we're running up against the clock here. Is there anything else that you'd like to share as a parting message?
Well, I did mention, Sherry, when we started that there is a new documentary out, and I meant to have the name available for you all. There's a documentary from a son's perspective about his father who had a brain injury and could not remember things. And the Brain Injury Alliance of Colorado is looking to sponsor that. We're actually going to sponsor it as a fundraiser and have a screening of it. If you are interested in more information about that particular documentary, it is new. Reach out to me and I'll make sure I get the name of it to you. I haven't seen it yet either. I'm very excited about it. And then there's a gal, Jamie Mo Crazy is her name, and she's out of Utah, so she's in the state next door. Her documentary is coming out as well. So I think there's some exciting documentaries coming up about brain injury that are going to be interesting for folks to take a look at. Happy to share those with you via email, though, if you reach out to me.
Yeah, and if you want to send me, Renee,
Yeah.
the names of those documentaries too, I can just put them at the end of this as
Oh,
well.
beautiful.
And yeah,
Beautiful. I will be happy to do that. I will be happy to do that.
much appreciated.
Oh, it was my pleasure. And thank you for having me on today.
Yeah, it was really good. You had a lot of thank yous in the chat. I don't know if you saw those, but
Oh, well,
yeah.
thank you guys. I appreciate it. We do take Anthem Blue Cross Blue Shield, George. Yes. But yes, you all are more than welcome. This is my pleasure to do this. And I love what I do every day.
And it shows, Renee. It
Oh,
definitely shows.
thank you.
All right. Well, with that, we'll end this and we'll see you guys tomorrow for the final Lunch and Learn series. We'll have Ashok Gupta with us from the Gupta program, and he will be talking about amygdala and insula retraining for chronic pain and for emotional dysregulation. So that's a good bit different from what we've had this week. So please do join in for that. And we'll see you tomorrow. Thank you. Bye-bye.